A hospital's mission, vision and values are certainly aimed towards the core necessities of delivering a profound service towards the healthcare sector. Talking Point connects with Dr. Jayantha Dharmadasa, Chairman of Nawaloka Holdings. Welcome to the show.
Morning.
In what ways has the Nawaloka Hospitals implemented when it comes to innovative medical practices as well as cutting-edge technology to enhance the quality of the patient's care?
True. Yes, we started about 39 years ago, started as a 100-bed hospital. Then we got the first CT scan machine. Then we did the first private sector heart CBG operations. So like that, we got all the modern equipment what is available in the world. We were the pioneers. So that have been now, after the 39th year also, now we have been expanding. There was a lull period in between due to the situation in the country. Other than that, we were all going with the latest technology available in the world.
And I think Nawaloka Hospital has been so close to the patients that the loyalty and the trust still continues, isn't it, Doctor?
True enough, yes. When the President came to when we had some function about our, I think that's about the 35th or 36th anniversary, the President said, this is the People's Hospital. That is true, which is, we are always open. Now we have 4 directors. All are on the ball, we are from morning 8 o'clock till night, late night. We are at it all the time and available on the phone. So any question, anything what is happening, they are there to answer.
How does the Nawaloka Hospital's chain prioritize the patient's well-being amidst the challenging healthcare landscape? And what steps have been taken to ensure the highest standards of care and safety?
Yeah, it is this. We had very few private hospitals. They were bungalows converted to hospitals. We were the first to start with a modern hospital, type of a
concept.
Hospital. Yes. Otherwise, they were, as I told you, they were bungalows converted to clinics,
That was the inception.
Yeah, about 40 years ago. Then after we started this, people didn't want to come to the places like this. They thought the prices are very high. They wouldn't get the correct medicine like what is available in the government sector. But little by little, after about say 5, 6, 7 months, then people were asking luxury rooms. They were all going for the better ones, not the normal bedrooms, but the better ones. That's how we started this, with a lot of challenges. But we succeeded.
I'm certain that you could certainly share some notable achievements or initiatives that have significantly impacted the healthcare sector in Sri Lanka, distinguishing Nawaloka Hospital chain as a trailblazer in the medical history and in the industry.
True. Yeah, because as I said, we didn't have patients at the beginning. People didn't want to come to private hospitals. They were used to go to the general hospitals, the government hospitals. Then when we got down the CT scans, the heart operation things, then people thought that we get the best medical care here. So most of the government doctors also joined us. So after 4 o'clock, they were not allowed to come from between 8 and 4. So after 4 o'clock they came, and there were a lot of publicity that was given by the patients for us. We never advertised anything. It was all given by the patients here. So that helped us to grow this far.
Their true opinions, their true service, which they spoke out.
Oh yes. Without the best of services, people won't pay money. We had the best healthcare nursing people here. Then we had the nurses training school. So we used to get about 150 raw girls, train them, and they were working with us. Still, some of them are with us after the 38 years. So it's a big achievement for healthcare industry in Sri Lanka that my father took a big chance. It was a big challenge for him. But from 100 beds we have grown up to 400.
The quantity and the number itself says.
True.
I presume this is the most suitable time and the most suitable personality to inquire this question, Doctor. There's quite a lot of talk in town with regard to the Nawaloka Hospitals that is freely available for sale.
Yes.
What is your opinion about it, Doctor?
That was one that I was going to tell you. Luckily, you asked me about it. Yes, there was, now this is about the fourth or fifth time that we have been having these rumours going on. Could be through jealousy, We are not for sale. We are not for sale. I can vouch for it. I can tell you 100% that we are not for sale. But we were looking for a partner some time ago, about 5-6 years ago. After this COVID thing came, the Araga layer, then that Muslim problem, was not the Muslim problem, the other problem that came up. So with those, there was a big lull period for all the hospitals. So we didn't want to take big bank loans and all that. We were trying to get a small partner for 10 or 15%, So after that again we thought, why give it out? And to keep with us. So we went through a bad period. Not only us, all the five major hospitals went through very bad periods. We have come through all that. So we are,
the industry was affected, isn't it, Doctor?
Never. Nawaloka will never be sold.
So that's a very promising note for all the patients that Nawaloka is not for sale at all.
Because my second son is now here. My daughter is here. So they have been trained and they are okay now. They are taken over. Yes.
So Nawaloka is forging ahead with more power.
Yes.
What are your future plans and strategies for further advancing the healthcare ecosystem in Sri Lanka, and how do you envision your hospital chain's role in shaping the future of healthcare in our island nation?
Yeah. Now, 2 weeks ago, I went to Japan to the Canon Corporation. Canon has bought over Toshibas. So now I visited Canon and I ordered 1640 CT scan, 160 CT scan, MRI machine, and 5 ultrasound, brand new ones. So we are catching up for the lost time, what the country went through, with the bad times. Now the interest rates have come down, so that is helping us in a big way. So all these machines will be here by next February, mid-February. So we are going to have the best of radiology unit maybe in Asia, not in Sri Lanka, but in Asia. We have been to in Japan, in Singapore, Pakistan, India. I've been all these places, to hospitals, but we are going to have the best unit here.
Excellent.
Yes.
What sets Nawaloka Hospital chain apart from competitors, and what would be your selling unique points, Doctor, when it comes to being the trendsetter as well as being the market leader in the healthcare sector?
We have no competition. I don't go for any of these things, We are all friends and we are trying to help the people in the country. All the major hospitals are doing that. And of course, we have to make our money and pay the salaries and all that. We look after our staff. This year we paid the bonus also, 1 month bonus. So that was, we are doing all that, There is no, I don't go for any this thing. I'm looking after my place. So that is, and the our pricing is supposed to be the lowest among the hospitals. So that's why it's always full. If you come for channeling, the channel section is always, in the afternoons, it's full up. So likewise, the bed strength is taken up. So I have no problems, now we are running well, yes.
Certainly a people's hospital with cutting edge technology as well. We were in a very productive and a very insightful discussion with Dr. Jayantha Dharmadasa, Chairman of Nawaloka Holdings. Thank you so much for connecting.
Thank you very much. Thank you.